Hey,
Hi, Doc. How are you?
good. How you doing?
Good. It's nice to see you, even though I
Nice.
saw you yesterday.
I know. Good to see you again.
I feel good
Oh,
still.
that's what I like to
I was
hear.
thinking, I was doing some gardening today and I was thinking about how I have no pain. So it's really awesome. It's
And
amazing.
that's what I love to do. That's what health is all about, is being able to do the things that you love to do and need to do, feel good doing it. So I
That's
so appreciate that.
everything. I don't know how many people will have joining today, but I was thinking, since I upload everything to the YouTube channel afterwards, that maybe a little intro would be good.
Sure.
Uh, Maybe like, even like how we met, right? I think
Yes.
that may be nice. So I'll let you start with that.
Okay. Hi, Carly. I see one of my awesome practice members is coming on.
Hello,
Um,
hello.
so how did we met right here, right?
Yep.
Right on Instagram.
Absolutely. And you came at the perfect time. I mean, I was kind of desperate, and I believe in that, right? That sometimes things are aligned and you just somehow found me when I needed help, and and that was amazing.
Aligned, no pun intended, right?
Right. That's
And
awesome.
and we talked about that in the beginning. Hi, mom. My mom is a big Mava fan.
Oh,
She
wow.
thinks
Hello, hello.
she wishes she had you during my brother and I's births.
Yeah, I don't know if there were that many doulas then, right?
Probably not as many, right?
No, it's a relatively
So,
new thing. But yeah, I met
well,
you,
it's
what, was it in
amazing.
October that we met?
I would have to look back at my notes at the office, but I would say
Hmm.
probably around then, right?
Yeah, I think so.
And we talked about that a lot in the beginning when you first came, that we both believe that everything happens for a reason. And
Hmm.
I truly believe that, especially in my office. Anytime someone walks through my doors or is on my table, they're there for a reason. And
Yeah.
we always try to be 100% present with that and make sure that each person gets, the special customized care that they deserve.
Yeah. And I mean, I want to say that I came to you, I was in acute pain,
Hmm.
right? With a
Yeah.
herniated, leftover from a herniated disc.
Yes.
I had seen someone before that unfortunately that didn't really work because of the pandemic, and it took a little while, but it was relatively fast compared to the fact that I'd been suffering pretty much. I think it started maybe 2 months after Riley was born.
And how
So
old is she now?
she's gonna be 2 in August.
I got to see her the other day, which was awesome. So
Yeah.
cute. Um, yeah, so that's the case for a lot of people. You were dealing with that for a
Yeah.
long time, didn't really have the right direction as far as how to really get to the cause of the problem. You were doing a lot of things, I'm sure, to help yourself, but we weren't really getting to that root cause of what was happening and really correcting it the right way. So um, I love your story, and it's the biggest honor to me when someone comes with a little bit of nervousness about it, and it's a new thing. You didn't really have a great experience the first
I mean,
time.
you're being kind. I think you're saying nervousness. I mean, at this point, I had a phobia. I
I
mean,
know.
I had a
Yeah,
phobia of going to the chiropractor. I was
yeah.
just like, I was so
You're not the
hurt
only one.
that there's just no way. But yet, because of the way we connected, I felt like I could trust you and
Yeah.
how the process unfolded. So what I want to say today is that don't wait till you're in pain to go to the chiropractor, right?
Number one thing, Mava.
But then also like to the pregnant people that will be watching this, it's the same, right? And now, like, I know if we're lucky enough to have another baby, like during pregnancy, I will make a point to go see you regularly because
Well, you
I
already
don't see
are.
a
So you're
pregnancy without, right?
you're one step ahead of it, and that is
Right.
the optimal, right? You're taking care of your body before you're pregnant
Right.
regularly, so that when and if that happens again, you're going to be ready for it. And of course, you're going to be under care during that time, and it's going to change a little bit depending as the process unfolds, because we do have specific techniques we use for pregnancy. But the most important thing is taking care of yourself even before you are pregnant. so
Yeah.
that your body can be working as good as possible. And that's what chiropractic is really all about.
So do you have like, can you explain to people like what's the difference between like regular chiropractic care and then chiropractic care in pregnancy? Do you have
Yeah.
like special techniques or like even like a mattress to accommodate the growing
Yeah,
body or?
definitely. So just to give everyone a little bit of an idea of chiropractic, just in case you don't even know what it is chiropractors are spine doctors. We're all natural. We don't use medicine and surgery. There's a time and a place for those things. My goal is to prevent you from needing that, right? So we look at the spine for alignment because this is what contains your spinal cord, your nervous system, right? Always have my spine with me.
I didn't
Never
know you
leave.
had a small, a
This
little
is my
model.
mini spine. Yeah, exactly. Just for
Awesome.
Instagram. So maybe you've been with me for a while now. What controls everything in our body?
Don't put me on the spot like that. I'm going to be like
Your brain, right? Your
brain.
brain and your nervous system. So your brain talks to the rest of your body through the nerves, which are like wires coming down from your brain through the spine and out the little nerves here. So your
Right.
brain, my brain's telling my hand to open and close right now, right? And that's coming through the nerves. So sometimes from stress, the vertebra can go out of alignment and it pinches on the nerve. Okay, kind of hard to see on here. But if that nerve gets pinched on, then the signal from to the hand is going to be worse. It's not going to be a clear signal. So then you're not going to have proper function there. And how about your heart and your lungs and your stomach and your uterus when you're pregnant, right? How's that going to connection going to be if you have interference on the nerves there? It's not good.
And also because like the relaxing, right? The hormone that we produce in pregnancy allows for everything to relax. And I noticed that things became a lot more mobile in my body, and therefore I felt like could go out of alignment like a lot
100%.
easier than when
You're
not
more
pregnant.
prone to misalignment during
Right.
pregnancy, especially because you have extra weight from the baby developing, right? So as far as the techniques, the goal is always the same in chiropractic. It's to have proper alignment in order to remove interference from the nervous system so that the body can function as best as it possibly can. Now, during pregnancy, we're focused a little bit more, and we always work on the lower part of the spine because that's the foundation. But the main focus of what's called Webster technique, which is a special technique that you get certified in after chiropractic school to work with pregnancy.
But now, this Webster technique, is it mostly for breech babies? Because I think that's when most people go to chiropractic, is when they realize, oh, my baby's not head down, I need to do something. And that's when people kind of
a lot of times
get to chiropractic. And very often it's like 35, 36 weeks. And it's like this frantic
late in the game.
Right.
Exactly.
Does it work also if the baby's not breech? Is it just a general pregnancy technique?
Of course. Yes, absolutely. And that's a huge point. Just like you said, don't wait until you're hurting to go to a chiropractor to get your body working properly. It's the same thing with pregnancy. You don't want to wait until you're having bad low back pain or you have a breech presentation to go to the chiropractor. You want to be under care the whole time so that you can ensure the best possible alignment of your pelvis and connection to the baby through the nervous system. And a lot of times that can hopefully allow for an optimal position of the baby. You don't want to wait until it's already breech. Then you only have so much you can do. And a lot of times, even though I always reiterate, chiropractic does not turn breech babies.
Yes.
I always say that. I don't touch the baby. All my job is to make sure the pelvis and sacrum is in alignment. That creates better space for the uterus and for the baby to hopefully move into a better position by themselves if the physiology of the body is going to allow that. And a lot of times that does happen. But the objective is not to turn the baby. The objective is to create proper alignment and make a better space for the baby to get into a better positioning. But the earlier you start taking care of the alignment during the pregnancy or optimally before, the better chance that you're going to have for better positioning throughout the pregnancy, more comfortable pregnancy, and of course, your specialty, a more comfortable delivery.
Right.
Yeah, because if you're all twisted and out of alignment, right, it's going to be harder for that baby to come out versus if you have a nice balanced pelvis, much better space, easier
And that's where we
delivery.
really kind of complement each other, as far as like my spinning babies tools, right? Being a spinning babies parent educator, I tell people too, spinning
100%.
babies is not going to like flip your baby either, but we work on the soft tissues to make
Yes.
more room to align things, and then you come in and then you work on, the
Structure.
bony structure. And I think, when people do both, when we have specifically a bridge baby, then I think that if the baby's meant to turn, the baby will turn, right?
Yes.
So if there's anyone here kind of watching that has a bridge baby, we really recommend like both approaches. But outside of a bridge little one, just like being in pain is a sign that something is off, right? And you have a choice. You can pop a Tylenol, which there's a study actually that I'm going to share about that came out recently, that Tylenol potentially can affect, could potentially put the baby at a higher risk for being on the autism spectrum.
Wow.
So little by little, those are coming out, and most doctors still tell pregnant people, like, you know what, you can take a Tylenol, it's fine.
Yeah.
And again, it's like, what we discussed is like if you have a headache or if you have some kind of pain, it's not from a lack of Tylenol in your body, right?
You got it. Yep.
Just,
exactly.
You can work on the root cause of things by
Yes.
getting adjusted. So,
and just taking care of your body, right?
Yeah.
So just like, what I do and what you do complement each other. It's so important to have a well-rounded wellness team, not only during pregnancy, but throughout your life. But, getting adjusted, I think, is such an important, like, to me, it's the most important, like, self-care thing. Like, it's not, of course, we're good at correcting a pinched nerve, getting you out of pain, but it's really like a self-care thing that you do for yourself that's just good for you. It gets your body working better. It feels good. So in that respect, besides just getting adjusted, it's so important to take care of yourself, to create a healthy environment in your body and prevent needing the medicine, like eating healthy, right? Because what you put in your body is what you become. You literally are what you eat. Right. So I think that's so important. If you look at something on your plate and you don't think you would like to become that food, then it might not be the healthiest thing.
That's a good way to
It might taste good, right? But you are what you eat. So what you put in your body is what your body's going to use for fuel and to make new cells. So you got to eat healthy. You got to move, right? We got to have motion in the body.
I know, for instance, like from like where I came from, this whole self-care thing. So I would meditate a lot. Like before I got hurt, I would do yoga. But, I felt like the yoga was, and it does, like I think keeps my body healthy and strong, but sometimes it's not enough. If something is misaligned, I can try to get into all those crazy yogi positions I can think of. It might not just align me. And that's when, really now I can't see a week without without seeing you, because
me either. I get adjusted every week too.
Right.
And you know my story when I got my first adjustment, right?
No.
In the delivery room.
Right.
When I was born.
Your father, yes.
Because my dad, Dr. Mike, who's a chiropractor too, that's the first stress to the spine many times is during the birth process, especially if it's a difficult birth or a C-section. There's a lot of pulling, twisting, forceps, things like that.
Like a vacuum, like
so
for Riley's
birth.
Yeah, we were in France, so she saw a chiropractor. So same thing for babies. People expect like those big dramatic adjustments that are really loud, but that's not how you work on a baby at all, right?
No.
Can you share a little bit about that?
Yeah, of course. So, actually one of the analogies we use is like, so there's no clicks or pops in a little baby adjustment. Okay. When you adjust a baby, it's so gentle. It's almost like the pressure that you would use to check the ripeness of a tomato.
Right.
Or like if you were to close your eye and kind of just like touch your eye on top, like that's how gentle an adjustment on a baby is. We're just holding little contacts and kind of encouraging the spine to get back into the right position and working on some muscles and loosening up areas that are kind of not moving properly or that may have gone out of alignment during the birth process. And that's really the best time to start taking care of your spine. at birth, because that's the first stress, and that's how we can prevent problems in the future and create a healthier generation. So that's
Yeah.
one of the things that I'm so passionate about, and you know this, is taking care of
Hmm.
babies and kids and pregnancies. And we're part of the ICPA, which is the International Chiropractic Pediatric Association. That's the group that also certifies you for Webster Technique.
Right.
And so, and we're a family practice. My dad and I practice together. My brother is a chiropractor in New Jersey. So we love to take care of families. And, you know, that's usually how it goes. Once one person starts to see the benefit, they learn about how to take care of your spine, then they want to get the kids in because it just makes sense. That's how we prevent problems in the future, keep them healthy, keep them away from the drugs if possible, and just ensure that they're
They just instill
developing.
self-care thing early
Yeah,
on, right?
exactly.
And yeah, like I was thinking with breastfeeding too, like especially if there's been an assisted birth, right? Or if the
Yeah,
baby was in a really funky position, then they're still gonna have some tension. And I know for
yeah,
some clients, of course, like seeing an IBCLC to kind of address the latch is important, but sometimes we need someone like you to step in and to help release whatever is going on so the
yeah.
baby can move freely and attach better. That's also why Riley saw a chiropractor when we were in France, was to help with that,
That
because
helped you out.
it
That
wasn't
made a
it
big
wasn't happening
difference.
for a while. Yeah.
Yeah, because a baby can't tell you my neck hurts, right?
Right.
But they just won't be able to turn their head, or they'll
Mm-hmm.
have torticollis and be stuck like this, or be colicky and just crying all the time. So
Right.
that's why it's so important. We get amazing, or digestive issues. They're not going to the bathroom. You know, we've adjusted babies and they go to the bathroom right on the table
Right.
because they're releasing the nerve that goes to their intestines, or we do some digestive work with them and get unbelievable results with that type of thing, all natural, right?
Mm-mm. Yeah, yeah, I can recommend it enough. So I don't know if there's any questions or anything else you wanted to kind of touch on.
Yeah, absolutely. I really think it's important to understand, you said it best, don't wait until you're in pain, right? Take care of your body proactively.
But I got
And
that
that's
from
how
you.
that's amazing.
I got that line from you.
Yeah. And
Yeah,
that's what I want to help people to understand, is to be proactive and to empower people to make good decisions about their health and to take care of themselves preventatively, and you know, make sure that you're just living your best life and your body's working as good as it can. And
yeah,
that's what chiropractic's all about. That's what I'm passionate about. And we love hearing stories like yours. And, you know, there's so many people out there suffering and don't really know where to turn or how to find a good chiropractor. So I really appreciate you having me on and sharing your experience with everyone. And, you know, just thank you for everything that you do to help everyone out there in the world. Being a doula and doing the spinning babies, you know, you're really playing a big part in doing that same kind of thing, empowering people and giving them
thank
some
you.
positivity in that special time. So really appreciate you, and I'm glad to have you on my team to help other pregnant people as well. And yeah, it's
Thank
really
you.
a
I
special
was
thing.
thinking maybe one day we can get like a chiropractor on the labor and delivery floor in hospitals. I mean, imagine what that would do, right?
Yeah,
If you
for
get the
the
spinning
mom and for the
babies
baby.
and the chiropractor, that would
Yeah,
be just incredible.
and that's
I
really
think that
important to
would
have that.
really lower the cesarean rate and
Yeah,
help with like
and
initial
that's
breastfeeding.
optimally what we want to prevent, right?
Yeah.
Um, One of my
Maybe.
favorite things that I'd love to share with you is, there's like, so dystocia, which is like a difficult labor, which is some of the reasons that you might have a C-section, right? So Williams Obstetrics is like one of the main textbooks for OBGs, and
Mhm.
they define the three reasons for dystocia. You know, the three P's: power,
Yes.
passage, and passenger.
Yes.
So
We talk
power,
about that in spinning babies. Yeah.
yeah, so power is like how the muscles work that have the forces to get the baby out, and
Hmm.
that's controlled by the nerves, right? So
Right.
if we have interference there, you're not going to have optimal power. If we free that up, you're going to have better signals to the muscles, better power to the pelvis. Passage is, of course, the actual physical space where the baby's coming through. So if you're out of alignment or subluxated, you're not going to have as open of an area to get the baby out. That's going to make things more difficult. And then, of course, passenger is all about the baby. So when we adjust the pelvis, we create optimal space for the baby's positioning, and we also open up the connection between the mother and the baby, because that's through the nervous system. So if anything's blocked in that lower back, in the reproductive system, you're not going to have as good of a connection between the mother and the baby. So physiologically,
it happens, and I'm sure you've seen it plenty of times, you know, when you do body work, like some people actually have an emotional release, right?
Oh, 100%.
Because that just, the body's finally letting go of something, and if there's any kind of emotional issue, especially the sacrum in women, I think that's it's very powerful. It becomes a very, almost like a, emotional, spiritual work.
Yeah.
Sure.
I've had people burst into tears after a first adjustment because it's just like releasing a huge, your emotional traumas get stored in your nervous system. So sometimes when we adjust you, it's not just a physical thing, it's releasing that. I've had people just start cracking up hysterical laughter, which is a lot more fun. But either way, it's affecting the emotions and the nervous system, and it's a physical, chemical, emotional, spiritual thing. And the other thing I would just say for everyone is, chiropractic is gentle, especially in my office. What we love to do, we really focus on being gentle and specific and thorough. When you come in, we're doing a whole exam on you and making sure that we know exactly what's going on with the spine before we even put our hands on you, and then walking you through each step of the process. So,
that was amazing.
So as you know, I offer everyone on your page a complimentary consultation with me. If you have any questions, reach out to me. I'm on Chiro NYC. I run that Instagram personally, so I'm always checking my DMs and happy to help in any way possible.
Thank you so much, Doc. I will see you.
Thank you, Maeva.
Tuesday next week.
I look forward to it.
Thank you so much.
Awesome.
Have a good evening.
Thanks for having me. You too.
Bye.